Okay, so for the third learning objective, we're going to discuss research in healthcare, and this is where we talk about evidence based practice. So, with evidence based practice, you can either use the term evidence based practice, or you use the term translational research, or you can use the term research utilization. They are all words that we use to describe applying evidential knowledge to clinical practice. This is in the sense of you go do research or you do some form of data analysis, and then whatever findings that comes out of that research or your data analysis those would then inform your clinical practice, or it could also mean your policy practice. It doesn't always have to be restricted to clinical practice. It could also be in terms of policy. Policy could be organizational policy, policy could be health policy, and stuff like that. So, the whole idea of evidence based practice is to decrease practice variability in the sense that we want it such that even if you're someone who goes to a clinic in Ohio, for an instance, you're going to get the quality of service as someone who goes to a clinic in Utah, for an example, is to kind of to decrease there being so many variability in determining how good a health service that you receive is going to be heavily dependent on where it is that you go. Evidence based practice helps in standardizing healthcare so that no matter where you go, you're kind of receiving a good healthcare service. And this way, you're also reducing increasing patient safety because the evidence-based practice or the research findings are one of the things it has to prove or one of the things it has to pay attention to is that patients are being safe. When we discuss some of the ethical principles, that goes into research as well. When we're doing research, we need to make sure the ethics of research is very much applied, and that includes in terms of harming the research participants. So that is a very core aspect of research, and so in letting research informs your clinical practice, a lot of patient safety has been built into your research, and therefore clinical practice or policy practice that is informed by evidence-based but informed by evidence is going to increase patient safety. It's also going to eliminate unnecessary costs because through research, we're able to figure out this is what works and therefore putting time and money into it, and figure out what doesn't work and therefore not putting time and money into it. So in this way, you're helping in reducing unnecessary cost. So, what is evidence? Because I've been using the word evidence. What is evidence? So, evidence can be defined as truth, knowledge, and this includes expert opinions and experimental or primary research findings or meta-analysis or systematic reviews. These are all the multiple ways that research is kind of looked at. Some evidence is seen as being stronger than others. For example, meta-analysis or systematic reviews are seen to hold a much have more value in terms of its quality as evidence versus expert opinion. So some evidence are kind of weak in the sense that they are unlikely going to majorly inform clinical practice. And there are those that are very high quality or good standard that are very likely going to, be more likely to inform practice. Example would be systematic reviews and meta-analysis. So, in some of your assignments, whether it's in this course or in previous courses, you would have, when you're doing your literature search, you might have come across papers that are systematic reviews. So, those are just know that that's what I mean in terms of systematic reviews. They're seen as being very high quality research or high quality evidence. So, the thing with evidence or research versus practice is that there's usually a big gap between research and practice. And for someone who is in academia, as I am, when you're on academia or you're a researcher, there's a lot of pressure for you to do research, to publish papers, and all of that. So you have a lot of turnout of papers with that researchers in academia, academics are always turning up. So you put in all of this time and sometimes money into conducting a research, and then you publish the paper. The paper is accepted and published and all that. So the question is, then what next? What happens after you've done all that? It's You can go on PubMed and you see multiple of research studies. The thing is, where do you go from there? So, but we have to translate all of this brilliant research that we are doing as healthcare professionals, and and experts in our field. We need to kind of translate those research that we're putting in our time and money into doing, and make it such that a place where it makes a difference, which is in a clinical practice or in policy practice. It takes time. The reason being that you want to have the highest quality of research before you go applying it into practice, so that you don't end up endangering the lives of people. To an extent, research happens in a controlled environment, right? Doing research in a hospital, for instance, has a lot of things that are going to happen that is unpredicted, and there's going to be too many variables, things that are changing, so many uncertainties, that research is going to be very, very difficult or even risky to conduct research in a hospital setting. And sometimes if you want to do that, you may want to kind of only use a subsection of the patients that you have to do research, and not the entire population, because the entire population means if anything goes wrong in your research, it will apply to so many other people, which can be a disaster. So you want to kind of contain that. So basically, what's happening is, in order for you to do research and apply it to practice, there's a lot that goes into it, and as a result there is a gap, sometimes years. It takes years between doing research and when your research gets applied to practice. And one of that is trying to make sure that when you take research, like I said, that is happening in a controlled environment, and put it into clinical practice, which is usually very unpredictable and many things can go wrong. You want to make sure that when you do that, that you are very much considering the safety of the patients who are going to be the recipient of your research. I think you guys can go. There's a couple of things that goes into research ethics and everything. If you think back at the Tuskegee research on syphilis and how that all happened, how they were doing it with real people who were receiving healthcare treatments, and how we want to kind of make sure that we're being very careful in terms of that, because now the quality of doing research on human subjects is much higher. So that is what brings, that's the reason, that's one of the reasons why there's such a gap between when research is done and when it is put into practice. Regardless, the whole aim of research is to make sure that we take the information that we know, the findings that we know from research, and get that to work in clinical practice. But it requires an understanding of the key concepts, some research concepts, and understanding the barriers to both receiving the care, the health services, and all the multiple things that come into play. Remember, like I said, it's very clinical practice is very unpredictable, and there's so many factors that come into play in the way that it doesn't happen with research, because research, like I said, is usually happening in a controlled environment. So to be able to take research and apply it to clinical practice, you have to have a good understanding of the key concepts and the barriers that come to it. And of course, we have the thing about accessibility of research findings. Some of the research that's been done, some of the very brilliant research has been done, are not free. You can't just go on PubMed, for an instance, or Google Scholar and get hold of those papers. Some journals have paywalls. To read one paper could cost you up to $40 just to read one paper. So research is not, is very, research is quite expensive, and some of the times accessing the research papers is not free. You have to pay for it. So which can bring a barrier in terms of getting a hold of those brilliant research that has been done. Also, you kind of want clinical mentors that have research understanding. Not everybody who is not a researcher understands research findings or understands the implementation of research. So you kind of need mentors, clinical mentors, who understand both research as well as clinical practice to be able to apply the information that is, the knowledge that is gained from research, and apply it into practice. And then you need to have a reinforcing culture, a culture in clinical practice that cares about research and understands that, with each time the research changes information, and some things become archaic, or they don't become very relevant. Some research that was done 30 years ago, for instance, may not be relevant today. But you need that reinforcing culture that understands that research can change practice, that just because research informed the practice 20 years ago doesn't mean that that research informed practice is still relevant today. So those one of the reinforcing culture. And also there has to be a desire in the part of the clinicians, and as well as administrators, to implement best practices. Clinicians and administrators that don't want things to change may just decide to stay where they are comfortable, what they've always known, and want to stay there. So these are all the things that has to come into play in helping to bridge that huge gap that is between research and practice. So there are a number of barriers to applying research to practice that I've already talked about. One of it is lack of time. As I mentioned, if you want to do a research in a hospital setting, you can't just deploy it to the entire hospital, right? You kind of want to put some level of control, the same control that research has, with an element of the unpredictability that of a healthcare practice. So you're kind of, to some extent, may end up running a parallel service. So you have some of your patients that are part of the research and some of your patients that are not part of the research. So you're kind of running a parallel service. Not every clinician or every clinical, every healthcare provider has the time or the manpower in terms of healthcare workers to be able to run that parallel service. And also, you may not have access to libraries within the facilities, or even you may not just have enough money to subscribe to journals where you can get those good research studies free. Like I said, a lot of journals have paywalls, whereby if you don't within a universities spend money into making a lot of journal articles accessible to students and to staff and faculty. But outside the university, some people have to rely on paying for the research that they have. So that lack of access is a barrier. This is not just library in terms of physical library in this facility, but also electronic library. Being able to afford to pay for the subscriptions to those journals. And then, of course, there's the lack of technology confidence. A healthcare provider may not have the kind of technology that was used in a research study, and therefore cannot apply the research findings. Or it may have it, but because of how highly, or maybe they don't feel so confident in using it, maybe they just leave it to one person. One person, they say, okay, you understand technology, here, you do it. And if it's just that one person that has to operate the technology, it's very difficult to apply the research findings into practice, because it's going to require a lot more people than just that one singular person who they feel is the designated technology person. And this usually happens in a healthcare provider where you have older healthcare workers who may not feel that comfortable with diving too much into technology and maybe more comfortable with delegating it to a younger staff. But to in order to make it a practice, it has to be something that everybody is involved in. And of course, there's the lack of knowledge on how to search for information, which is something that you guys don't have that problem when you took 215 and when you did 375. Hopefully, you've done that. You have been taught how to search for literature with Google Scholar as well as PubMed, and in order and also to use the information that is found in those literature, in those articles, to complete your assignments. So that's kind of a skill that you would have gained as a result of taking these courses that I just mentioned. And then, of course, you have the problem of some clinicians or some clinical practice just don't put a lot of value into applying research to practice. They just want to stay where they are and just feel that this is okay. It worked for us 20 years ago. It should work for us today, even though science may have kind of progressed past 20 years ago. It's not all clinical practitioners that want to move at the speed of science. So, what are a couple of informatics tools that you can use in terms of applying evidence to practice? There are a lot of softwares that have been designed to collect, sort, and organize, aggregate data. Your ability to be able to retrieve the data, analyze it, and disseminate it can be very important when it comes to these informatics tools. And then you have the Red Cap, which was provided by the Institute of Translational Health Sciences. So this is a data repository that contains a lot of clinical data. It also has you can research electronic data capture with Red Cap as well. And then we have PubMed for PH, which is PubMed for handheld device. This one is provided free. And with the PubMed, you're able to do your Pico searches and do clinical queries as well. And I didn't mention this, it's not in the slide, but you have a lot of data sets that are also available outside of RedCap or outside of PubMed or some of the software. You have a lot of registries. You have cancer registries, those ones that you can use to pull out information on cancer. And then you have Medicaid and Medicare. They also have a lot of a wealth of data sets that can help inform practice because these are information that are routinely collected in providing healthcare service to Medicare and Medicaid patients. So by retrieving those data and analyzing it, it's a little less of the research is a little less of a controlled environment, in the sense that this is information that were gathered through the normal health practice. So if you take those information and you analyze it, it kind of gives you a wealth of knowledge about how you can apply some of your findings towards clinical practice. So this is where I end for the class today. Please remember to watch all three learning objectives of the videos, and of course, if you have any questions, to please post it on the Q&A board, and I would answer your question. All right, do have a lovely day. Bye.